some serious ones and so forth. I want to have a little fun with what I do when I'm in church. I get obsessed with looking at the back of everybody's neck. What? Dr. Bo here. I like to look at the back of everybody's neck, and I think sometimes of like this here. It should be smooth. But if you have a vertebrae, and you all know which vertebrae I'm talking about, when that atlas gets stuck, and that means you got to turn your head, and you can't do it with using the pin at the base of the skull, so you have to use your lower neck. You have to recruit the lower neck, and no, you can't turn. So you can't turn that lower neck until you do what? Until you straighten it. And that's the reason why the lower neck is straight. It's not because of looking down at the phone or looking down at the books and so forth, the computers. It's from recruiting this to turn. In order to make this able to turn, this knuckle here has to separate a little bit so you can use it to turn. If it's curved, again, you can't turn using your lower neck. So if your neck's curved like that, you can't turn it. And most of the time when I look at the back of people's heads all day or their necks, I see a big crease. Guess where? At C5. Because that's where they're turning all the time, because the atlas is locked. And that's why I work on that atlas. Come in there, make sure that's loose, and make sure they're turning their heads at the top. See how easy that turns? If those muscles up there get tight, it's not going to turn there. You're going to have to straighten your neck and then turn at C5. And if you look at where C5 is in the neck, it's just like here. If I bend this repetitively like that, if I ask that C5 to work, I'll see a crease right where C5 is. You'll see it, the skin is smooth at the top and the skin is smooth at the bottom. And that means that person has these vertebrae here aren't moving and these down here aren't moving, and they're left with just the C5 vertebrae doing all the work. And there's a crease in the skin. And I can let's look at my neck, and you can see my neck is not correct for years. The crease is there, meaning I use my C5 too much. Let's see if I can show it. Can you see the crease right here? And I've seen pictures of me, and there's a bigger crease on one side than the other. This side's worse. There's a flatness here, and this side really turns when I turn my head to the right. When I turn to the left, it doesn't move, doesn't crease that much there. And that causes a crease in the skin where that C5 is wearing itself out. And if you look at my x-rays, you look at almost everybody's x-rays going down this road here, you'll bring them in and you'll see the C5 vertebrae is arthritic or calcified, because the body's going, put more calcium in there, it's doing a lot of work. And take the disc out of there so it can't take it anymore. It's only supposed to move, what I say, from like right there to there is supposed to be C5 and C6. And most people, because the atlas is locked, they're using C5 and C6 right at the beginning. And the atlas and axis are never turning until they're looking almost out the back door of the car. You see? So that's why the skin, when you see somebody in church, I do the skin examination, not when I'm paying attention, but you want to see multiple creases. You want to see a crease there, 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 you want to see a crease there. And that means the whole neck is moving, not just one spot. And that's what we want. We want all the vertebrae moving, sharing the workload, not just C5. So next time you're in church or wherever, sitting behind people in the theater or whatever, look at their necks and you'll see one crease. And unfortunately, that means that the upper neck is usually not working. And if it's not working, it doesn't hurt. They don't even know to complain. And that means the middle of the neck is doing all the work, and the skin, you'll see a crease there. God bless. Like and subscribe. Thank you.